We have warned weeks ago that people are going to start, sadly, to die totally unnecessarily as an indirect result of the war in Gaza, as a direct result of the siege. This is due to the spread of diseases which we have reported on among children, like diarrhea and other diseases, but also among the older population. And this is largely to do with the immune system of 2 million people that is suddenly dropped, and also with living conditions, the lack of clean water, the overcrowded living conditions, even outside of UNRWA shelters. In some apartments where people have sought refuge, there are 50 people, for example, sharing one toilet. The lines in UNRWA shelter just to go to the shower could take maybe 3 or 4 hours. Lack of things like soap. We're speaking about the very, very basic to keep oneself clean. Some people have not been able to wash for weeks on end. Some have not been able to change their set of clothes because simply when they fled their homes in the north or in other parts of Gaza, they didn't bring anything with them. This war must come to an end, and there needs to be a humanitarian ceasefire. The pause that we have witnessed for about 1 week brought respite, brought calm to people in Gaza who have for 50 days been through hell. And we were able, thanks to that pause, to bring in much needed humanitarian supplies. Right now, we are back to square zero. Heavy bombardment, heavy airstrikes, massive displacement of people, except people have literally nowhere to go. They're being pushed into 1/3 of the Gaza Strip. There is no place that is safe. People don't have anything. They lack food, they lack clean water, they need everything. And so it is really time for this war to come to an end. There's been enough suffering, enough.